welcome back to clinic. Today I'm with Celine, who's our lovely patient for today. She's 47. You French?
Yes, I am. You're French. From the south of France.
From the south of France. You living in London?
I live in London.
Okay, perfect. Celine has been coming to see our clinics for a few years, but today the focus is on a kind of holistic regenerative rejuvenation plan. So maybe if you could tell us a little bit about yourself, please, Celine, and what you're after.
Right. So I've been doing Botox treatment for a while. And I've noticed for the last year or so that the Botox treatment was not as effective here on the side. And I have lines coming down to my cheek area. And I think it's because of the density of the skin that's changed with age. It's a perimenopause as well, and what happens to the skin. I've lost density here. And I can see on my neck as well in this area. So that's what I wanted to discuss today. I've always had an asymmetry with my nose because of an accident I had surfing when I was 10 years old. And whenever I do treatment, I talk about it because some treatments sometimes help with rebalancing the view of the nose that is not straight. I'm always a bit nervous about pain. I'm not super courageous. I'll be never be courageous enough to do microneedling, but
Okay.
it's a bad time of first patient. So, but I trust you to do a good job.
No, thank you very much. No pressure. It's great. It's a great case. And if I can just take an opportunity for now to talk through how I see things. So, first of all, we have to remember there are some previous fillers that Celine has had, and I think everything looks really nice to me. Everything looks really natural. We can see that there's been some projection here to the front of the cheek. Normally, you'd imagine someone in their mid-40s, you'd definitely have some flattening to the anterior cheek. So if I could see with my eye, where do I think there's already been some filler, I can see some projection here, okay? So this has already been treated. Everywhere else, though, we have some very characteristic volume loss, and it's a very treatable case. And so I would look at this in multiple parts. We need to, first of all, build the deep structure and restore the volume where we've lost volume. And then once we've done that, we can then look at the skin and we can look at biostimulation. And so today's treatment is going to focus on these areas of volume loss that I see in the lateral aspects of the face. And I'll talk through the anatomy and our treatment plan for this. But it's mostly around the temples, the cheekbones, the lateral cheek fats. And then we could possibly also look at a little bit of rebalancing in the midline. And I also think there's an area of volume loss at the piriform fossa as well, where the maxillary bone is recessing and we get this deep shadow here. Once we've restored the volume, the next thing we can then look at is the skin condition itself. And you notice here that we have some of this crepey skin around the eyes, as Celine has mentioned. And I think that'll be a really nice way to show how we can use other kinds of injectables to really improve the condition of the skin on the top of a very nice, deep structural baseline. So that's our treatment plan today. We've taken some photos, so you'll see some before and afters at the end of this video. Should we get started?
Yes.
All right, let's go. Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like. All right, so let's take a look at marking up for treatment. I've drawn on a really important line. This is called the line of ligaments. It connects the ligamentous temporal adhesion with the lateral orbital thickening, with the zygomatic cutaneous ligament insertion, and with the mandibular ligament. And this line is really important because it divides the midface into the medial and the lateral aspect of the midface. They age differently. If you're lateral to this ligament, the arrangement of tissues are in very nice concentric layers: skin, fat, smats, and then we have the deeper structures, and they can glide up and down or glide downwards with aging. And that's how we start to get, when we start to have volume loss like this, we start to get a little bit of heaviness down here in the jowl. Whereas medial to this line of ligaments, the arrangement is different, and we have muscles that move across the layers, like the zygomaticus major or the LAO muscle or the LLS muscle, and that kind of keeps the muscle and the tissues in a specific fixed position. And that also means that when the patient smiles, if you give me a big smile, my finger moves, relax, and smile again, and relax. So this is the mobile midface, whereas here, if you smile and relax, my finger's still. And that's because we have muscles that transect through the layers medial to this line. So why is that important? Well, the reason why Celine is presenting to us is because she's noticed that she's started to get volume loss lateral to this line of ligaments. And that's really important when we think about treatment sequencing. Generally, as part of our principles within the GEM framework, we're going to start superior to inferior. Okay, that's kind of obvious and self-evident. We want to treat structures higher up because they can start to lift. But we also want to start lateral and work our way medial. And we do that because it's been shown that actually if we start laterally, we pre-tension the tissues and the ligaments. And in doing so, we actually need less volume medially to achieve the same results. And so I'm very happy in this case to demonstrate a superior to inferior, lateral to medial, and the third principle is deep to superficial. So we'll start with the deeper treatments and we'll end up with our more superficial treatments. These give us a bit of a guideline for how we would start to sequence a treatment in quite a complex case like this. So what does that mean for us today? Well, we've got a very kind of targeted area of volume loss in the temple. And I think this is a very good case to demonstrate the needle down to bone technique, where we'll just be injecting some Juvederm down onto bone. The filler will end up inside the muscle, and this will help to restore volume in the temple. It should also give some support to the tail of the brow. I can then treat lateral to this line of ligaments and give the zygomatic arch a little bit of definition, whilst also enhancing the apex of the cheek a little as well. So I can create some prominence here and tail it off nicely laterally. There's a very nice area of the lateral cheek fat, which would be an important target for us today. And so I'm going to be focusing on a cannula treatment in this area, which will give us even more support to the medial midface. And I can treat the gonial angle down here. So we're working top down, deep to superficial, lateral to medial. Once I've done that, I think Celine, if you look on profile, would benefit from a tiny bit of projection in the chin as well. And in the process, what we would have achieved just from this single kind of sequence of treatments is a very kind of structural, rejuvenating treatment plan, all following our injection principles and avoiding adding additional heaviness to the anterior cheek. So let's get started with this first sequence, and then we'll see how it looks. So first injection is here, down onto bone. I've got my 1 up, 1 over technique. So I'm moving 1 centimeter up the temporal crest and then 1 centimeter down into the temporal fossa. I'm always palpating here to make sure I am not going to be injecting through the superficial temporal artery. And I can feel the artery further up. I can feel this artery moving higher above my injection point. So I've ascertained that that superficial temporal artery is not overlying my injection point. I've actually got Juvederm Voluma here, but I've changed the needle to a 25 gauge needle. It comes with a 27 gauge needle, but the larger the needle, the better the sensitivity for an aspiration. And that's going to be really helpful when I'm injecting the temple with a needle, because when I'm down onto bone, like this, if I just touch down to bone now, I can increase my sensitivity, getting a positive aspiration, which is, in my mind, a really valuable part of my safety process. I'm going to give this aspiration a good 5 to 10 seconds. when I'm sure there's no blood in the hub of the needle, I'm then going to slowly inject half a syringe of Juvederm Voluma. You'll notice also that I'm injecting at this 45-degree angle rather than perpendicular. And the reason for this is because I'm injecting down onto bone. The filler will then track backwards towards the needle. The filler will pass upwards through the muscle, that's the temporalis muscle, and then it will hit a fascial plane, that's the deep temporal fascia. And if I stay at an angle like this, I'm increasing the likelihood that the filler stays underneath that deep temporal fascia. Injecting at a 45-degree angle has value in other parts of the face as well, and that's all explained within our GEM framework, which you can look up and read about. But a 45-degree angle in the temple with a needle is actually recommended to ensure that the filler doesn't track all the way back to the surface of the skin. We can also use a higher G' product and a very slow injection speed that also helps with that too. Okay, well done. I will just give 10 seconds of gentle pressure. But it's going to be helpful to see how much, even just 0.5 cc. If I sit you forward and look in the camera, please, come forward, please. Yeah, fantastic. So I really want you to appreciate here how much we can improve that shadow that exists in the tail of the brow, but also you notice that this brow tail is also lifted a little bit like this as well, and that's all because we can restore volume in the temple, in this case with the needle technique. Let's move on to the zygomatic arch. We'll stay with our Juvederm Voluma, and this next technique I'm going to just create a little bit more definition on the apex of the cheek, and then continue the tail of the definition down this cheekbone. And in order to do that, I'm going to use a cannula, and I'm facing the needle in the direction that I want to go, in this case, towards the tail of the cheekbone. So this is my entry point, just through the skin. I don't need to go any deeper than that. Using a 22 gauge cannula now. You'll see a little pop, and this pop is me pushing behind orbicularis oculi muscle, there. And here I can create a little bit of definition. Remember I was talking about the medial and the lateral midface? Well, this is the intersection between those two targets, where we will find the light reflex, where we want the maximum points of projection. And to do this, I have to inject deep underneath muscle, because this is the mobile midface. And what we want to avoid is injecting filler just under the skin here, which will then move when the patient smiles. Whereas if we inject underneath the muscle, then we will actually avoid any of that mobility when the patient is expressing. So that's how we would avoid that. And so that's a nice deep structure that we can create when we're making this cheek apex. Once we've achieved that, we can actually move superficial to treat the rest of the cheekbone, because it's not mobile. And so what I mean by that is I can move my cannula now into the subcutaneous plane and pass it all the way down the cheekbone like this. And I'm confident here all we're doing is creating a little bit of subtle shape. This is not going to be particularly structural because it's so superficial, but it will help me to create this beautiful contour along the cheekbone and connect it up with my projected apex here.
And when you're superficial, you do get, particularly with a firm product, a bit more bang for your buck. Someone who's slim too, you see that definition with even just a small amount of product.
Let's move on now.
Thank you for the mention to see me feel better.
Everything.
First.
Actually, if you go sit forwards again into the camera for us, there we can see now I'm giving it a shape to this side of the cheekbone, and you can see it kind of come outwards more so. This side is a little bit more horizontal. This side has a bit more of an angle to it, a bit of lift to it. Okay, I'm back. This is the case. So now we're going to treat the side of the cheek. We call this the preauricular area. Okay, a little injection. Okay. Now I'm injecting this one with some volume today, but notice that the skin here would really benefit from some collagenesis. So as part of a second treatment plan, I'd like to see how much we can enhance this quality of the skin. But the first priority for me today is to actually create some of that deep structural support. In this case, it's not particularly deep, it's actually just in the subcutaneous plane. We do a lot of scans and ultrasound imaging at Harley Academy, and Dr. Mehta is part of our kind of clinical leadership team who's very regularly assessing where the gels end up when we're using ultrasound after injections. What do we see when we're injecting area?
Look, for a lot of the time, where we think these gels are ending up, they are not always staying in that position, which we automatically assume is a bad thing. But at the end of the day, we're doing these injections to have a clinical effect in person. If they're having that effect, then that's the priority. But it has definitely changed the way we think about these injections, and particularly we see it on Jen, and we just saw on the temple there, where our needle tip is not the target for the placement of that gel. Needle tip, layer 5, but the gel itself we know is going into the muscle and tracking superficially into both the deep and probably the superficial temporal fat as well.
So what tips do you have for injectors to avoid kind of injecting into the wrong places?
So first thing is just being mindful of that. Second thing is, what can you do with your instrument? So if you're using a needle perpendicular, you're almost guaranteed to have a little bit of product tracking superficially. Doesn't mean that using a needle is bad, but then you can adjust your volume. So if you do slow injections with a low volume, you're less likely to create that pressure for the filler to displace superficially. You can use a cannula as well, and again, that gives you some distance from your target area to your entry point and makes it less likely that fillers going to move. And for more advanced techniques, as either Dr. Tristan Mehta, the temple is coming in a slight angle, but that can be more technically challenging, particularly someone at the GK test.
Great, thanks Max. I'm going to sit you forwards now. Let's look in the camera again. Hopefully now we can really start to see the structural support that we've been able to achieve injecting back behind those lines of ligaments. And the final things I want to do in the midface is the deep piriform space. We have a bone sitting behind this shadow, that's the maxillary bone. And with aging, that bone resorbs, it moves backwards. The angle also decreases, so it becomes a bit more like this and backwards with aging. And so in the process, that allows the soft tissue to hang forwards and have shadows. So a structural injection down here is very, very valuable. Head back. One of the things to appreciate here is we have the infraorbital nerve, which is moving with the vessel medially towards the upper lip here. And so it can be a little bit sensitive, this injection. And so I have a few ways to minimize the potential pain in this area, but it's one that I would just say you just have to start breathing. Breathe in.
You sure want to do this?
Honestly, it's not going to be too bad. Okay, I promise. So this is a good example. A patient's a little bit sensitive with needles. Okay, I promised her that it's not going to be too bad. Okay, so let's put me on the spot, and we are going to create a very comfortable, very valuable injection. Okay, so I just want you to breathe. Breathe in. Breathe in. And breathe out. Okay, you're doing great. Keep breathing. Stay nice and still. 1, 2, 3. That's it. That's the worst bit. And that's how deep, keep breathing, I have to go to reach the maxilla. Very, very deep. A lot of maxillary recession here. I'm going to aspirate. Keep breathing. Give it a good 5 to 10 seconds. Keep breathing. Doing great, Celine. And then I'm going to slowly inject. The injection is not the painful bit. Here. And as soon as that first part of the filler goes in, everything becomes more comfortable because it has some lidocaine. When you're injecting the piriform fossa, always be looking at the side of the nose for any blanching, any skin discoloration. And I'm going to show you what it looks like when we really help to restore that deep, bony resorption in the maxilla. 10 seconds more. Keep breathing.
And because it's part of the nerve coming out the infractive foramen, it's quite normal to get some numbness to the lip and the side of the nose.
Perfect. So, honestly, how was it?
Just a pinch.
Just a pinch?
No, it wasn't too bad. I saw a lot better than what I thought.
Okay, I'm very happy to hear that. And
I can feel a bit of a numbness that you mentioned. It felt like when I go to the dentist.
Yeah,
I'll never
exactly right.
forget. Yeah.
so the nerve continues to treat the supply the upper lip, and the filler has them local anesthetic, and so the lip becomes numb. So now come forwards.
How long will the numbness last?
Just a couple of hours. Okay, so I'm hoping now we can see, certainly from this direction, I can see a reduction in the depth of that shadow. Okay, and it really supports the rest of the face. Very natural, kind of elegant kind of treatment where we're restoring what's naturally been lost over time. Final thing I want to do is a little bit back here to give the jawline some definition and a tiny bit of projection in the chin. And then that will complete this deep volumizing sequence. And then we'll come back and we'll do part 2.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
So now we're going to treat the gonial angle with a needle. And this one is to create some deep structural support on the corner of the jaw. I'm using Jupiter Volux here to give that really kind of highly projecting deep structural support. Providing I'm touching on bone, I'm really not that concerned about the vascular risk in this area, but I would always aspirate with a needle.
That's another good example of the needle being on layer 5, but the target for revolumization, really most of that product's ending up in the masseter muscle.
Yeah, a bit like the temple in this case.
Yes.
And so that's point 1. Point 2. And that's point 3. The intention in this is to increase the height of the angle of the mandible, which was previously not particularly well defined. So I'd like to show what this looks like if you come forward again. And maybe we can see here now there's just a little bit more sticking and creating this shape to this corner of the jaw, especially on this side you can see. It's really starting to connect everything together, whereas this side is quite diffuse. I can't quite see where the corner of the jaw is. Here we can now see that. The final thing I'd love to do is now just create a little bit of projection in the chin. You see that here. It's just a little bit rounded and the mentalis muscle is rotated upwards just a little. I can project this just downwards, not so much forwards, but I can just create this. And I think that would be a very nice feature for Celine as well. So here, in order to continue with our principles, the chin, a bit like the temple, is one where I want to improve the sensitivity of my aspiration. And so to achieve that, I'm going to use a bigger needle. I'm going to use a 25 gauge needle. And that's just another safety measure we like to have. In females, we want the chin to be relatively narrow, the same width as the nose. And the needle will tell me where the fill is going to go. In this case, I want it to go downwards, and so my injection is creating that same path. I'm going to start with just one injection either side of the midline. So we touch down onto bone like that. And I'm going to aspirate with my 25 gauge needle here. Again, still using Juvederm Volux. Okay, 0.25, perfect. So that for me really, really beautifully created that lower projection. I just have to do it on the other side now of the midline. So one more needle. Touch down onto bone. If you come off the bone, just find the bone again. Well done. Aspirate. Just breathe, yeah, perfect. Slow injections once. Great. Thank you. Was that okay?
Yes.
Anything with the midline, if it's the nose or the forehead or the chin, it's always good to look from the doll. So if you just raise your chin up for me, I'd like to always make sure that we have a nice symmetry, and the best angle for that is above. And also, when it comes to these areas, if there's a little bit of bleeding like this, I'm happy, okay? You want to pinprick bleeding in these areas. It shows that there's good perfusion to the skin. And so that's, as frustrating as a bit of blood is a very good sign for the vascular health of the tissue. So now, I'm very, very happy with that chin. Let's see forwards. I'm going to take a moment to examine. Now we've done half the face, half of the treatment sequence. So you can see here, I hope, very nice structural improvements to the face compared to this side. I'm going to treat this entire side now off camera, and then I'll show you the full before and after, and then I'll talk about what we're going to do for the next treatment. Right, so we're back now, having treated this side of the face as well, and let's just come off the bed a little. Right, now let's take a look at the full treatment plan. So from the top, we did the temples, okay, with down onto bone to the needle, lifting the tail of the eyebrow and supporting the periorbital area. Treated the apex of the cheek and created some definition along the cheekbones to give this lovely elevation. And then I treated the lateral cheek crap to support the midface, the piriform fossa with a needle. Patient was very happy in the end with the level of comfort. We then did the corner of the jaw and the chin, the projection in the chin. If I show you the full chin on profile, I think that's a really nicely positioned chin, given the rest of her jawline is all connected through now. So this for me is the essential baseline structure that we need to have before we now move on to a biostimulatory filler treatment, which we'll come back and do in part 2, where we're just going to enhance the condition of the skin using a biostimulant. But first of all, Celine, take a look in the mirror for me and tell me what you notice the most.
Oh, here, this part, I can see it rebalanced. I can see a clear improvement. In where parts were very hollow and very bony became bony.
It's natural.
Yeah, well, it's very natural.
Yeah.
So
Mm.
thank you for
No, honestly.
after that. And I'd like to build on machinery as well. And it was not painful.
Yeah, okay.
Well done.
I appreciate that. Thank you.
So yes, yeah.
Okay, wonderful. Thank you so much, Celine. We're going to continue to take some photographs, and we'll see you next time. Okay?
Yes.
Hi, Tristan here from Harley Academy. This treatment was Celine. She was 46, and we sequenced a full face rejuvenation, starting with deep structural support and then moving through to biostimulators. You can do it the other way around. So some patients, you may prefer to do the biostimulatory treatments first, get the skin condition at its best, and then add the volumetric support. In this case, the patient was comfortable starting off with hyaluronic acid fillers, and that was very nicely defined by treating laterals of the line of ligaments with some supportive treatments in the piriform, fossa, and also the chin. And all in all, I think a really good example of the injection principles informing our treatment sequence. So look forward to coming back for the second part, and we'll see you there. Okay, welcome back to clinic, and we've got Celine with us from 4 weeks ago where we did a full face filler treatment. And we said that Celine would start off with filler treatments, then we could discuss possible biostimulatory treatments, and we'll get onto that. But the first thing I want to do is just get your feedback, Celine, on your treatment and the following few weeks afterwards.
So treatment on the day, very good, very comfortable. You did a great job of reassuring me, and as you know, not the most comfortable patient, so you did a good job, explaining everything and taking any anxiety away.
Good, I'm pleased to hear that, thank you.
So on the day itself, comfortable. There are things that I prefer than others, but other than that, it was okay.
Yeah.
And then as the weeks came back, the week one was good, very comfortable. On week two, I had some bruising on the two sides here of my jaw with bumps. And
I got the photographs of that.
Yes.
You sent them into clinic. I looked at the photographs, and I know Celine's a little bit anxious, and so sometimes I can tell when I'm going to get an email, 2 weeks later with some of the absolutely routine things we're going to see, which is some swelling and some small bruises, and it's our job to then look at that and usually reassure, but I'm always making sure that there is no actual risk or complication. And you had a bruise.
Yes.
Fundamentally, you had a bruise.
And that disappeared on week 3.
This has been on week 3, but still frustrating.
No, I mean, for me, it was not frustrating. It was more, I need to be reassured that it was all normal.
Good. All right. So I reassured Celine, and she's back now. And I hope you'd agree, she's looking really, really well. I think everything looks really beautiful. I'm going to take you through, if we can just zoom in on the face here, and I'll show you what I see. So first of all, treated the temple, and the temple in now is kind of, there's even still some volume loss, but the volume here is supporting the periorbital region. I think it's age appropriate, and that's looking really good. I'm loving this definition along the zygoma. You'll notice this volume across the midface now, and even at rest there were some of these static lines that were visible, and now at rest we've got this beautiful contour across the lower face. The shadow here at the nasolabial fold is reduced, as we saw on the day. And then the projection on the chin, I'm really happy with. If you turn all the way this way, even from profile, I'm really happy. And give us a really big smile, please. And relax. So very natural facial expression. And you couldn't tell, even up close, that there has been any filler treatments. And I think this is how it should always look, using the right products in the right depths, using the right techniques. So then I said, okay, we can talk about biostimulatory treatments, and I think Celine has had enough. I think we wanted to address some of the radial skin lines, potentially improve the condition of the skin, and we talked about a few different options ranging from skin boosters, treatments like Profilo and polynucleotides, all the way through to stronger collagen stimulators like Alonze or Radiesse. But that's probably going to be the subject of a further video for us. But for now, Celine's very happy, and I don't want to push her further down that road if she doesn't want to go further down that road. So that would then conclude Celine's case study with us.
Thank you.
Any final comments? If you're a patient watching this video, what would you recommend to someone who's interested in injection treatments?
Well, first is trust. I mean, trust in professionals and trust a good advice, where I feel very comfortable because I can feel we can have an open and honest conversation about what I see and what you see, and I like the recommendation. I did feel booking this today that we will need to do more, but I can see the great impact it's had on my skin. So I'm postponing this conversation until September
Until next
or
time.
be back. But no, it's I really feel the trust. And again, that's from someone who likes to control things and a bit anxious. So well done.
I appreciate that. Thank you so much, Celine.
Thank
We'll
you.
see you next time.
Yes, see you soon.
All right. Thank you.
Thank you.
Bye.